So for this case of the week, this is kind of a traumatic accident that this patient had. She was in a volleyball tournament and she had a volleyball accident. Now this girl was 20 years old, and unfortunately this picture I have is the picture she took while she was out of town at another dental office. And so the purpose of the video is kind of showing we can work together with different dentists. We can come up with good treatment plans that kind of get a patient back to being stable and healthy, and of course the teeth looking good again. So here you can kind of tell, this is a little bit of a funny angle, but basically her front tooth was knocked like out of position, and another one of her front teeth had a big corner knocked right off of it. So the dentist out of town was able to get the teeth into the right spot, took this wire and actually put it across the teeth to give it some stability. And of course you can see the big missing corner on that one tooth. So when she got everything stable, we were able to take that corner and put that corner back. But then over time we had to keep an eye on those front two teeth. And what happened to those front two teeth, since they were so jarred out of position, the nerve was basically disconnected from those teeth. And so those teeth eventually died, which basically just means a little tube inside that tooth, the nerve tissue, the blood supply, that all died away, and so that had to be cleaned out. And that clean out process is called a root canal. So she had root canals done in her front two teeth, and then when it was all said and done, we put 2 veneers on the front two. She's still, she's only 20 years old at the time, so her gum tissue still needs a little bit of time to mature. But if you consider where she started, 2 teeth knocked out of position and 1 corner completely broken off, she was able to get the teeth stabilized, put back together, and now she has a good looking smile with veneers that blend in and match with her neighboring teeth. And so a quick acting dentist and people who seek dental care right away, we can help stabilize some of these cases and end up with a very nice result. So that is today's case of the week. Take care.